What are the different types of ultrasound scans? How many types of ultrasound scans are available? How many types of the different ultrasound scans are available? In this video today, we are going to talk about the different types of ultrasound scans. Tugenda kwogera ku bika ebyenjawulo ebya scans oba ka TV so that ojja kuba osobola okumanya Doctor waba akusindisa okola scan ojja kumanya kika ki ekya ultrasound scan kyewetaaga okukola. We are going to discuss the different types of ultrasound scans in this video, and remember, you are most welcome to our channel, Gerald Massa, the Health Educator, and remember, you can subscribe so that you keep watching new videos we release every day about fertility, reproductive health, and ultrasound scan. We do create awareness about the different types of fertility. So in this video, we are talking about the different types of ultrasound scan. Without further ado, the first type of ultrasound scan is what we call the transabdominal ultrasound scan. The transabdominal ultrasound scan. By transabdominal, we mean that ultrasound scan which is done specifically to look at what could be happening in your abdominal organs. Let's take an example. You could be having lower abdominal pain, or you could be having abdominal pain which is generalized, and then your doctor examines you and then sees that you actually need to do an ultrasound scan. Then your doctor is going to request for a transabdominal ultrasound scan. Tugambye nti type eya scan esooka gye tuyita transabdominal ultrasound scan, era tugambye nti scan eno eba esobola okulaga organizo oba ebintu eby'omunda ebiri mu abdomen, katugeze ng'ekibumba oba ensigo oba ebyenda biri bitya, kyandibanga maybe muyinza okubeeramu ebizimba oba obuzibu bwonna bwonna obuli mu lubuto lwo. So with the transabdominal ultrasound scan, images of your organs, including the liver, the spleen, the kidneys, the pancreas, and also your bowels or your intestines will be actually taken, and then they will be reflected on the screen, whereby what will be happening is that your doctor will be able to interpret these images and then see where the problem could be, and then make a conclusion or make a report for you, so that your primary doctor where you started from will give you the best treatment. A case in example is you may go to hospital and then you are showing signs of your face swelling, and then your legs are swelling, they've actually increased in size, and then you are not able to urinate. Your doctor will most likely request for a transabdominal ultrasound scan, and on the request, your doctor will put that close attention should be paid to your kidneys or your renal system. So when a transabdominal scan is being done, close attention will be paid, or close attention will be taken when ultrasound images of your kidneys are being visualized. If at all the ultrasound scan shows that your kidneys have increased in size, and then they are also filled with fluid, or they are appearing very large, and then they are also very black in color. In scan language, we call this an anechoic appearance. Then there are high chances that you could be having a condition, or you could be having a problem known as hydronephrosis. Hydronephrosis is when your kidneys are filled with free fluid. Tugambye nti oba okoze scan naye ate ebifaananyi ne bifuluma ne biraga nti kidneys zo oba ensigo zo ziyongedde okuba nga zizimba ate za bbulaaka nnyo ate zirimu okwegamba okuba nti kwegamba zeeyongedde okuzimba, then ekyo kirwadde mu luzungu tuba tukiyita hydronephrosis. Hydronephrosis kiba kitegeeza nti ensigo zo zijjuddemu amazzi era nga wandibanga oli mulwadde wa nsigo. So ultrasound scans are very important in identifying what could be happening to your body. If you have taken the various types of treatments and you are not getting better, then it's high time you do an ultrasound scan. We are talking about the different types of ultrasound scans, and we have said that the first type of ultrasound scan is what we call a transabdominal ultrasound scan. Transabdominal ultrasound scan. We are going to go to our next type of ultrasound scan, but before we proceed, remember to subscribe, smash that red button so that you will be able to watch new videos we release every day, and then you will be able to learn about your body, learn about fertility, learn about reproductive health, and also learn about ultrasound scan. I welcome you to our channel, and we are proceeding with our next type of ultrasound scan, and this is known as we've talked about the transabdominal ultrasound scan. So the next type of ultrasound scan is what we call the transvaginal ultrasound scan. The transvaginal ultrasound scan. Tugambye nti ekika ekyokubiri ekya ultrasound scan oba ka TV Dr. wo kagenda okusaba ke kano ke bayita transvaginal ultrasound scan. Transvaginal ultrasound scan specifically is a type of ultrasound scan where a special probe or a special instrument on the ultrasound scan machine is going to be inserted in your private parts or your vagina. What happens is that prior education and then consent should be taken from the patient or from the client before this procedure is done. Transvaginal ultrasound scans are normally done to assess how your private parts are, and then also to get clear images of your uterus or your womb and your ovaries. Actually, it is the best recommended ultrasound scan, although even with transabdominal ultrasound scan using a convex probe that is with ranges from 2.5 up to 5 megahertz strength, it's also really good. It can give images of your womb and your ovaries, but a transvaginal ultrasound scan can give much more better images of your womb and your ovaries. So a transvaginal ultrasound scan is a type of ultrasound scan where a special instrument or probe is inserted into your private parts, and then images of your reproductive system, images of your uterus and your ovaries will be taken. Tugambye nti ekika ekyokubiri ekya scan kyekino kye tuyita transvaginal ultrasound scan. Tugambye nti mu transvaginal ultrasound scan akagundi ke bayita ka probe kabanga kantu musawo kakwata bakateeka wansi mu bitundu byo ebyekyama, ate ne kabanga kawa ebifaananyi ebyanabaanayo n'amajigo, and then from there doctor wo aba asobola okuvunula ebifaananyi bino n'akubuulira oba nabaana eriko obuzibu oba erimu ebizimba oba terimu bizimba. We've talked about the different types. We are talking about the different types of ultrasound scans, and we have said that the first is what we call the transabdominal ultrasound scan. I hope you're taking notes. The next is what we call the transvaginal ultrasound scan. The last part of, actually the next part of ultrasound scans is what we call the transrectal ultrasound scan. Transrectal ultrasound scan or the rectal ultrasound scan. In the rectal ultrasound scan, what happens is that still the probe, there's a special probe for rectal ultrasound scans. The probe or this instrument will be inserted into your rectum or actually through your anus, and then images of your womb will be taken. Rectal ultrasound scans are done in patients whereby the it is not possible to do the transvaginal ultrasound scan, and maybe it's even very hard to do the transabdominal ultrasound scan. For example, if you are a woman and you have undergone a special procedure in theater, you've had an operation known as a total hysterectomy. A total hysterectomy. Total hysterectomy means removal of your womb, removal of your uterus, fully, nothing remains behind. So if your uterus has been removed by a special procedure, we've said a hysterectomy, and then your doctor wants to find out how you are healing, and then maybe since it is really very painful through your private parts, and it may not be possible to do the transvaginal ultrasound scan because we presume it is really very painful, and maybe your private parts are actually really not, actually they are very tender, then your doctor will most likely request for a transrectal or a rectal ultrasound scan. It will give clear images of your womb. Sorry, the womb is already removed. I'm sorry about that. So it will give clear images of the part where your womb was, and then it will show how the healing process is taking place. It will show how the vaginal cuff or the cuff, actually it will show the vagina, it will show how your private parts are, it will show whether there are things which are developing, for example, pus formation or abscess formation. It will show whether healing is taking place well or it's not taking place well. So we have talked about the different types of ultrasound scans, and we have said that the first type of ultrasound scan is what we call the transabdominal ultrasound scan. We've said that the next type of ultrasound scan is what we call the transvaginal ultrasound scan. And lastly, we've said that there's also a transrectal ultrasound scan. Remember to subscribe for new videos we release every day. I welcome you to my channel, Gerald Massa, the Health Educator, and remember to ask me all your questions down below in the comments. Have yourself a fantastic and healthy day. See you in my next video, and may God bless us all. Bye-bye.